2 patients died and at least 5 more got sick from a routine procedure because of a medical scope infected with a superbug. 2 lawsuits have been filed now against the maker of the scope linked to the superbug outbreak at the Ronald Reagan UCLA Medical Center. So how exactly does someone get an infection from a scope that is supposed to be disinfected in a hospital? Dr. Marc Siegel of the Fox News Medical A team has an answer to that and so many more questions. Doc, how's it happen?
Well, Leland, it's because the scope they use actually, it goes down into the stomach and then it makes a right-hand turn into the gallbladder area and pancreas, and there's a lot of bacteria in there, and those bacteria can cause a contamination if the scope isn't properly sterilized, and then it can go to the patient, and then it can be transmitted to other patients by stool. So it's not just deadly bacteria like this one, it's all bacteria that we worry about. This one in particular, because it's very, very hard to treat.
When it comes to something like this superbug infecting on this scope, is this an issue of the scope not being sterilized in the right way, in the sense that the superbugs are really hard to kill when they're on the scope? Or is it the issue that the superbugs are hard to treat, or both?
Well, first of all, it's a great question. First of all, the problem is that it occurs because the scopes aren't, in my opinion, being properly sterilized. And the scope I described has to be sterilized much more than any other because it gets into dirty areas. The second problem you pointed to is we're not disinfecting our hospitals properly, and we're overusing antibiotics both in the hospital and the community, which causes bacteria to mutate and become superbugs, because they're like looking for the combination to the vault, Leland. The more we use antibiotics, the more they figure out ways around it. Millions and millions of colonies of bacteria are going to cause superbugs to occur if we overuse the antibiotics.
So in that sense, of all the things that you think is going to go wrong when you go to a hospital, how do you protect yourself in the sense, I'm going in, I have to have one of these scope procedures all of a sudden? Do you say, oh, by the way, did you guys use bleach this morning? Did everybody wash their hands? What can patients do to protect themselves?
Well, this is a pretty rare problem, but I think that patients need to be aware of these things. I think patients also should be reassured that we're calling them superbugs, but they are treatable, and we do have antibiotics that works against them, but we also need more made, and drug companies don't have the incentive to make more antibiotics because they're not big profit makers. We need a push there. We need incentives for drug companies to make the kind of antibiotics that will get rid of something like CRE without causing the side effects of the antibiotics we have. I am not telling people to go to the hospital and ask their doctor, look, what about this superbug? What about this superbug? Because it is still pretty rare. It's more of a wake-up call that it's an emerging problem that we have to nip in the bud.
Right. I guess what I'm asking, though, is that as you head to the hospital and you realize that all of these unknown risks that as patients we have no idea about, as a doctor you do, is there anything you can ask your doctor, anything you can talk about before you have one of these procedures, or do you basically just have to trust that they're disinfecting these scopes in the right way they should be?
Here are my points on this. 1, ask if your scope has been properly disinfected in between use. Absolutely. 2, make sure the doctor seeing you is washing their hands and wearing gloves when they're treating you, and that they discard the gloves afterwards. Look and see if proper hygiene is being followed. Number 3, if somebody is prescribing an antibiotic for you, make sure it's necessary, and be aware of the fact that maybe someone is just prescribing it because they think they have to, knee-jerk something. Ask for an explanation. Doctors have to be willing to talk about why they're using antibiotics, what bacteria they're treating, and whether things are being properly disinfected.
Well, yeah, to your point, sometimes it's a lot easier to phone in a prescription than to explain to a patient why they don't need one. Dr. Marc Siegel, we appreciate your time, sir. Thanks so much.
Right. Be on the lookout. Good to see you, Leland.
Thanks, Doc.